Hello and welcome to yet another edition of Wellbeing Wednesday. By way of introduction, my name is Dr. Eno Nsima Obot. I'm a board-certified internal medicine physician in addition to being a professional life coach. If this is the first time you're joining us on the Wellbeing Wednesday, I encourage you to go ahead and look through our archives of videos. The mission of the Wellbeing Wednesday is to provide you with information that is designed to get you into action to enhance your overall health and well-being. Today, I'm going to speak about a topic that probably you're not too well aware of. This month is actually Cervical Cancer Awareness Month. Cervical Cancer Awareness Month. Now, I know we're at the middle of the month already, but if you're a lady, you probably have your cervix and it exists with you for the rest of the year. So I'm going to share some thoughts that I have with you along the lines of cervical cancer, particularly as it pertains to the recent recommendations that were made by the American College of Obstetricians and Gynecologists. Now I'm going to emphasize that these are recommendations slash guidelines. Recommendations slash guidelines. And for each woman, I really truly encourage you, after you go through these recommendations, to really make sure that they are in line with your personal history. Now, what many of you may not know is that I am actually a cervical cancer survivor. And if I had stuck with the cervical cancer guidelines as was put forth by the American College of Obstetricians and Gynecologists at about the same time that I was found to have an abnormal pap smear, I'm made to understand that in 2 to 3 years I had a highly aggressive cancer that would probably not have been curative. So the great news is that I stuck with my instincts, which was to make sure that I get yearly pap smears, not the current recommendations, which is every 3 to 5 years. I had had a normal pap smear the year before and still ended up with a highly aggressive cancer that may not have been curative. So again, my recommendation to you is to have a dialogue with your healthcare provider, preferably your OB/GYN, about what pertains to your particular unique situation. And I'm going to stand on my soapbox again and say, unless you're a woman having sex by yourself, in other words, just yourself, and I know I'm getting graphic here, I would highly recommend that you stick with your annual exam. Because just like I said, if I had skipped my pap smear for a year or two, then I would not be here talking about the fact that I've been cured from cancer. So I'm going to go ahead and attach the recommendations. And again, I'll just attach them here. I really don't want to discuss them in detail because they may sound very confusing. And again, I'm going to say go out there right now and say I do not agree with these recommendations, just like a lot of my colleagues, OB/GYNs inclusive, do not agree with the fact that a woman should extend her pap smear to every 3 to 5 years. So if you are a woman who has decided to do that, I hope that my coming out here and sharing this with you will make you think twice. If you do not have access to health care or you don't have insurance, there are certainly free resources that you can tap into through your Department of Health, your local health department. You can find those resources and just make sure you get that pap smear, because as we know, early screening and early detection saves lives, just like it did for me. So again, it is Cervical Cancer Awareness Month. If you have a ribbon, go ahead and wear it. It's teal. And I'm really excited to be able to share this with you. We're going to go more into details on some subsequent Wellbeing Wednesdays about the course of cervical cancer, particularly as it relates to HPV, particularly as it relates to the stigma associated with HPV. I'd certainly like to have a conversation around that because I think a lot of times people feel that they're stigmatized, they don't want to talk about it, and then it becomes more secrecy, and secrecy certainly does not enhance awareness. So the truth is, if it could happen to me, it could happen to anybody. And I found that out, the hard way. I have had the burden of having to tell people bad news about being diagnosed with chronic illness, and when it happened to me, it certainly gave me a different perspective. Just as a heads up, along the lines of being diagnosed with a chronic illness, I'd like to share my journey with you. I have an upcoming teleseminar on Thursday, January the 17th at 8 p.m. It will be on the Learn It Live platform, and it's pretty much speaking about bringing mindfulness when dealing with a chronic illness. And I'll be sharing some tips with you, some information with you, whether you're dealing with a new diagnosis of a chronic illness such as diabetes, hypertension, or cancer, that certainly you can still take back your control and still learn how to live through this and not let it, run your life. So again, it is Cervical Cancer Awareness Month. I want you to have an honest dialogue with your healthcare provider, preferably your OB/GYN. I encourage you not to stick to the recommendations of getting your pap smear every 3 to 5 years and skipping that, because you may not be as lucky as I was. Just have that conversation, be informed, and remember that guidelines are just that, guidelines. You want to apply that to your personal life. What's relevant to you? What are your risk factors? What's happening in your life? What is your body telling you? Listen to the inner signals, and it will definitely go a long way to enhance your health and well-being. And if you are diagnosed, at least you're having an easier chance at cure. Until next week, here's to health and well-being. Dr. Anno signing off. Goodbye.